Sometimes medicine can feel like a real mystery, right? A patient shows up with this puzzle of symptoms, and the doctor, well, they have to become a detective to solve it. Today, we're going to pull back the curtain on that whole process. We're going to crack open a real case, straight from a clinical textbook, to see exactly how a master clinician thinks and solves the puzzle.
So yeah, that's the big question. When you're faced with this really complex set of symptoms, where do you even start? It's not usually some single flash of brilliance. No, it's more like a methodical investigation, gathering one clue after another to build a case that's just impossible to ignore.
So, our story kicks off with a patient who's having a really tough time catching their breath. They're totally fine just sitting around, but the second they try to do anything, boom, they're short of breath. Now that might sound like a pretty common complaint, but in medicine, even the simplest symptoms can be a thread that when you start to pull it, unravels a much, much bigger story. The investigation has officially begun. Okay, now the doctor steps onto the scene. And they're not acting like a scientist in a lab with all sorts of fancy equipment. Not yet. They're a detective, and their first and most powerful tools are the simplest ones they have: their eyes, their hands, and their ears. The physical exam, this is where the first critical pieces of evidence are always found.
The first clue is a visual one. The doctor just looks at the patient and notices something called a malar flush. It's this very distinct reddish, almost purplish color on the patient's cheeks. It's subtle, so easy to miss. But to a trained eye, it's a huge hint that the body might not be getting enough oxygen, which connects directly back to that shortness of breath.
Next up, the sense of touch. The doctor puts a hand right on the patient's chest to feel their heartbeat, but instead of a normal kind of push, they feel this sharp, really distinct tapping sensation. It's an unusual feeling for a heartbeat for sure. So that's another piece of evidence for the case file.
All right, now for the ears. Out comes the stethoscope. The doctor listens. That normal lub-dub rhythm is there, but the first sound, the lub, is way louder and sharper than it should be. You see, it's not just about what you hear, it's about how you hear it. The quality of the sound itself is a massive clue.
And then, the doctor hears it, the smoking gun. Right after the dub, there's this extra sound, a low-pitched, kind of rumbling noise. This is not a normal heart sound, at all. This is the sound of turbulence, a crystal clear sign that blood isn't flowing smoothly inside the heart. And that sound, it changes everything.
So let's recap our clues. We've got a reddish flush on the cheeks, a weird tapping heartbeat, a super loud heart sound, and now this rumbling murmur. Individually, they're just a bunch of odd facts. The real magic, the genius of medicine, is in connecting these dots and seeing the hidden pattern that they all make together. So let's see how the clinician puts this puzzle together.
And this brings us to a really crucial idea. See, when you're starting out, you often rely on verbatim memory, just memorizing lists of facts and symptoms. But expert doctors, they use something called gist memory. They don't just see the individual clues, they instantly recognize the pattern the clues are forming, the story they're telling as a group. It's about understanding the underlying plot of the disease.
And this is where that gist really starts to take shape. We're translating the clues. That malar flush, that's a sign of low oxygen. That tapping feeling and the loud love sound, guess what? They're not two separate things. They're the feel and the sound of the exact same event, a stiff heart valve snapping shut with way too much force. And that rumbling murmur, well, that's the sound of blood fighting to get through a narrowed opening. You see, the individual facts are starting to merge into one single cohesive story.
Now, to really lock this down, every good detective needs one final piece of hard evidence. For our doctor, that's a chest x-ray, and what it shows is incredibly revealing. It shows an enlarged left atrium. That's the heart chamber right before the problem valve. It's swollen from all the back pressure of blood that just can't get through. The pattern is holding up perfectly. The visual clues, the clues from touch, the sounds, and now the imaging evidence, they all point in one single direction. The gist of the case is now crystal clear. The mystery is solved.
The diagnosis is mitral stenosis. All of those seemingly separate, random signs were actually classic features of this one specific condition.
So what in the world is mitral stenosis? Well, to put it simply, the mitral valve, which is a critical little door between two of the heart's chambers, has become stiff and narrow. And this is almost always caused by an illness from the past called rheumatic fever. Because that doorway is so narrow, it obstructs blood flow, basically creating a traffic jam in the heart.
This causes pressure to build up backward all the way into the lungs, which is exactly what was causing our patient's shortness of breath. Every single clue we found points right back to this one central mechanical problem.
But look, solving the case isn't the end of the road. For the patient, it's really just the beginning. Getting that diagnosis allows the doctor to switch hats from investigator to strategist and create a plan to manage the condition and help the patient.
The very first step is to figure out the severity. And this isn't a guess, it's done by actually measuring the valve's opening. A normal valve is about 4 to 6 square centimeters. As you can see here, as that area shrinks, symptoms start showing up. First with heavy activity, then with just ordinary activity, and in severe cases, you can get symptoms even when you're just resting. This precise classification is what guides the entire treatment plan.
And that plan is totally tailored to the patient. For milder symptoms, medicines called diuretics can help reduce that fluid pressure in the lungs. If other complications pop up, like an irregular heartbeat, there are other medications for that. But for the really severe cases, the only long-term solution is to physically fix the valve, either with a balloon procedure or with surgery.
And this brings us right back to where we started. As the author of our source text, Dr. Baliga, puts it so well, it's all about connecting the dots. It's the skill of seeing the forest, not just the individual trees. It's about finding that gist in a whole collection of facts. And that, right there, is the art and the science of diagnosis.
And that really makes you think, doesn't it? This way of thinking, of piecing together all these different clues to find the bigger pattern, it's not just for doctors. In our own lives, at work or at home, what problems could we solve if we just stopped getting bogged down in the isolated facts and started looking for the story they're trying to tell us?